Nadia Stanback was diagnosed with type 1 diabetes when she was 3 years old. She depends on insulin to live, and she can never miss a dose. Nadia is one of 8 million people in the United States who depend on insulin to manage their diabetes, and her family is one of many who live in fear that at any point they may not be able to afford it.
Because she simply can't survive without it. It's not something where we could just manage her food intake and prolong her life without insulin. And so access to it is probably my number one priority as a parent. So there were many nights, and there still are many nights, that I'm left awake wondering, like, what do I do? How do we stockpile? Can we stockpile? Can we afford to stockpile?
Diabetes is an expensive chronic condition, and many people struggle to pay for their insulin. Even those with insurance may have high deductibles and copays that make each month a financial juggling act. It doesn't have to be this way. Civica is a nonprofit pharmaceutical company that's transforming the generic marketplace for the better and for good. We have the mission and values of a nonprofit and the business acumen to sustain it. With the help of many, we're working to make quality, affordable insulin accessible to everyone who depends on this important medicine to stay healthy and stay alive.
We're about solving the problem. We really determined that the only way to solve the problem was actually to develop these medications, manufacture them, and market them at the lowest cost. I believe we live in a great country, and I believe in free market economics. However, in many cases for medications in the US, it's not working. Insulin's the poster child for that. We're all about giving these patients the medications they need at affordable prices and give them hope that they can live a normal life without some of the burdens that we put on them with the current system.
Before getting my insulin pump, I needed about 10 to 12 shots of insulin per day. My insulin pump changed how many shots I need, but I need more insulin every day when I get older. Because it's my life support. I don't have a choice whether or not I take it.
Since starting our journey of advocacy work related to this disease, we've met families that have had to choose between paying their rent or electric bill or filling their child's insulin prescription for the month.
Civica will change that dynamic. Guess what? We're going to sell them for one low price.
The Civica insulin program has been made possible by support from nearly every corner of the diabetes ecosystem. We have raised much of the funding needed to cover startup costs, but we seek additional visionary leaders to invest philanthropic dollars to get us to goal and beyond. We are on the brink of a transformative moment, poised to make quality, affordable insulin accessible to all who need it.
Civica's in this for patients. Until we announced affordable insulin, there was no check on the marketplace, nothing to cause prices to come down, and no guarantee that they would stay down for the long term. What Civica brings is certainty. We're at a point in time when insulin prices are changing, some products are being discontinued, some manufacturers are struggling to supply. An investment in Civica is an investment for the long term to ensure that insulin is always available and affordable for the people who need it.
It's hard enough to have this disease without having to worry about whether or not you can pay for your insulin. For donors who are interested in making a long-term lasting impact on their communities, I can't think of a better investment than Civica RX.